Welcome to the Pilgrims Hospice Breathless Management Programme. We'd like to discuss what breathlessness is, the cyclic nature of breathlessness and anxiety. We're going to look at fitness and the importance of activity. We're going to look at positioning, good positions and not such good positions. And then we're going to talk about breathing retraining. When you become breathless, it can make you fearful and anxious. When you become fearful and anxious, you have a release of adrenaline. And adrenaline can increase your respiratory rate. It can cause your muscles to become increased with tension. This can promote poor posture. These combined together can increase your levels of anxiety and adding to your breathless. So it goes round in a vicious circle. What we would like to do is try and reduce your levels of anxiety so that we can help with your breathing and your breathlessness. When you become breathless, it can lead to a loss of fitness. As we've said, when you get breathless, this can make you fearful and anxious. So what may happen is that you'll stop what you're doing and reduce your activities. This can lead to muscle weakness and reduced fitness levels, adding to your breathlessness. So it's important to try and do a little bit of exercise whenever you can to stop that muscle weakness and reduction. Activity. We've said it's important to push yourself a little bit every day, but listen to what your body says. If you're feeling tired and not up to much, maybe just sitting in the chair, moving your legs or your arms can be enough. Remember, it's not dangerous to become moderately breathless, especially with activity. It's quite normal when doing a little bit of exercise or changing position, walking from room to room, that your breathing may well change. Sometimes the best way to deal with a fear is to expose yourself to it. So maybe do a little bit of exercise, feel your breathing change, and then practice some of these techniques that we're going to talk about in a moment. Walking is a great exercise. If you're able to, walk a little bit every day. If you can go outside, have a walk outside. But if not, just walking from room to room or along the corridor can help with your breathing. When you stand up, your tummy moves down so that you can get the air better into the bottom part of your lungs. Try and exercise in sitting or standing. Sometimes the fear of becoming breathless is often the main factor that will stop you from maintaining or increasing your activity. That might be your fear, or it might be the fear of the people around you, seeing you becoming distressed. Let's talk a little bit how to cope with breathlessness. If you have oxygen, nebulizers or inhalers, make sure they are at hand if you're going to do some exercise or something that might increase your breathlessness. It's important to think about positions of recovery. Some people find leaning forwards or backwards, supporting themselves on their arms, can help recover from breathlessness. If you have a walking stick or a frame, leaning on that can help support your shoulders so that you can get the air down to the bottom part of your lungs. If you're sitting, make sure you're supported by pillows, your head and neck is comfortable. Trying to relax your mouth, chin and jaw. If you're in bed, a good position, if you're able to, is lying on your side. If you're lying on your side, supported by pillows, your tummy will move out the way and get the air down to the bottom part of your lungs. If at all possible, avoid slumped lying or slumped sitting. This is when your bottom slips forward in the chair or the bed, your tummy pushes up on the bottom part of your lungs, on the big muscle called your diaphragm, and prevents you from taking deep, effective breaths. So we want to avoid slumped lying or slumped sitting. Breathing control. This can help to make your breathing more efficient, can help to gain some control over your breathing. It can also help with relaxation. Make sure you're sitting or lying comfortably. Relax those shoulders. Open up your chest and gently allow your stomach to rise and fall as you breathe in and out. Breathe at a rate that is comfortable for you. If possible, try and breathe in through your nose and blow out through your mouth. Your nose is your natural heater, filter and humidifier. It warms and moistens the air before it gets into your lungs. If you're not able to breathe in through your nose and you're a mouth breather, that's okay, but beware, sometimes your mouth can get very dry, so have regular sips of water to keep your upper airways moist. If possible, try and make the out breath slower than the in breath. Ideally, your out breath is twice as long as your in breath. Try to practice this breathing control technique 3 or 4 times a day. Practice when you're feeling good, so at those not so good times, it will come automatically. You know what to do. Get in a good position. Relax those shoulders. Breathe down towards your tummy, in through your nose, out through your mouth. Breathing slowly out. When you become short of breath, think of a good resting position, something that's comfortable for you. Allow your breathing to slow down a little, then try your breathing control. In conclusion, you can help cope with your breathlessness by looking at it differently. Remember, it's not dangerous to become moderately breathless when you're doing an activity. Sometimes it's the fear of becoming breathless that will limit you rather than the breathlessness itself. It's good maybe to get a little bit breathless, especially when exercising, knowing that you can control your breathing. Set yourself a challenge each day. Do your breathing exercises every day. Practice them at good times. Try them in combination with some relaxation. If you get anxious, think of your posture, think of the position you're in, and try your breathing control. Remember, don't expect to change things overnight. It might take a while, but if you gain some control of your breathing, you will find life is less restricted.